This morning, a woman heads to surgery to receive a new heart at one of the top heart transplant centers in the country. And Ken is inspired to take the mound less than 1 year after transplant. Interventional cardiac surgeons prepare to fix the tender heart of a 3-month-old boy. And 5-year-old Omari is heading to his first day of kindergarten, just like the rest of his classmates. This afternoon, farmers harvest vegetables from our hydroponic greenhouse, which yields more than 5,000 pounds of produce each year. And a high school senior named Luis is learning the nutritional value of baby kale. This evening, Lois is prepping for surgery to receive a double lung transplant. And Craig is accompanied by his guitar instead of an oxygen tank. All day, every day, Newark Beth Israel Medical Center and Children's Hospital of New Jersey are committed to providing world-class leading-edge medicine to every patient. A top teaching hospital offering state-of-the-art patient care and an anchor institution that thrives on empowering our neighbors and partnering with our communities to live healthier together. Newark Beth Israel Medical Center and Children's Hospital of New Jersey. Let's be healthy together.
Hi, welcome to this very exciting program we have for you tonight. I'm Dr. Marc Lindner, and I'm one of the pulmonary and critical care physicians at Newark Beth Israel Medical Center. Before we get started, though, I wanted to just take a minute and reflect on the truly amazing efforts of all the frontline workers and the progress that we have accomplished in this unprecedented time. Tonight's program will be on caring for the long-term effects of COVID-19, a topic that we are only just beginning to understand. Tonight, we have Doctors Christina Migliore, Director of Pulmonary Hypertension and Advanced Lung Disease, Dr. Joshua Lee, Lead Transplant Pulmonologist, and Dr. Jesus Gomez Abraham, Associate Director of Lung Transplant, who are going to discuss their roles here at Newark Beth Israel Medical Center and answer some questions about COVID-19's long-term effects and what we have to offer at Newark Beth Israel Medical Center. Linda Kamate, our Senior Director of Public Relations and Marketing, will also be monitoring the chat room throughout the discussion. So please, don't hesitate to ask questions. We will have some time in between each of the panelists' brief presentations to be able to ask some of these questions. So first up, we have Dr. Christina Migliore.
Hi, I'm Dr. Migliore. Thanks for joining us this evening. I've been attending at Newark Beth Israel for some time, and I've been here for almost 20 years doing all my training here. I'm currently the director of the Pulmonary Hypertension Program and Advanced Lung Disease Program. In our hospital encompasses our programs, we treat numerous patients with pulmonary problems. We treat patients from COPD and asthma to advanced lung disease such as pulmonary hypertension, sarcoidosis. We have one of the largest pulmonary hypertension programs in the state of New Jersey. We also have a lung nodule screening program, and we have minimally invasive techniques on diagnosing early stage lung cancer. We are New Jersey's only lung transplant program, and we're also involved in numerous drug programs and trials throughout our system. Recently, we have developed a new post-COVID recovery clinic. In this clinic, we're seeing all types of patients who have suffered from and been diagnosed with COVID and wind up having this post-COVID syndrome. This program was started back last summer, and there are a lot of things, as Dr. Lindner said, that we're just learning about this disease, and we are treating and trying to manage these patients both in our hospital and throughout our community. Thank you, Mark.
Thank you. So next, we have Dr. Joshua Lee.
Thank you, Dr. Lindner. I want to thank everybody for joining us on this webinar. So I'm also an attending here at Newark Beth Israel. My role here is primarily as a lung transplant physician, and I take care of those patients who have undergone a lung transplant. I'm involved in all the phases of the transplant process, including evaluating potential candidates, to managing their chronic lung diseases while they're on a waiting list, and finally, their postoperative care in the immediate post-op setting, and also the long-term care of our patients after a transplant. So the topic today is really to discuss the long-term effects of COVID-19, and I think that really the personal health effects, the obvious socioeconomic effects, and the governmental policies is yet to be fully understood. We know that SARS-CoV-2 is a novel coronavirus that's transmitted via the respiratory droplets, and like most other respiratory viruses, the primary infection site are the lungs. And when we look at to see the extent of damage that the virus can do, we kind of look at it in two different stages and phases in terms of the effects on the pulmonary system. So the initial stage consists of more of an inflammatory response, which is responsible for the symptoms that we get: fevers, chills, aches, fatigue. And for reasons that are not really clearly understood at this time, we know that for some people, this immune response can go unchecked, and this can cause collateral damage to the surrounding tissues. So as the ongoing inflammation occurs, the lungs are no longer able to function, and due to the damage, and they start to manifest as low oxygen levels, shortness of breath, high carbon dioxide levels. And in about 5 to 8% of patients, they will progress to what we call adult respiratory distress syndrome and respiratory failure. So in patients who recover from the acute phase of the illness, some will continue to experience symptoms after their initial recovery. And this is what we refer to as post-COVID syndrome. And although we don't really understand the exact mechanism in terms of why these patients have these prolonged syndromes, we think it may be due to a compensatory anti-inflammatory syndrome that's responsible for their effects. So when we talk about post-COVID syndrome, it's really variable from patient to patient. And because of the variability, there really is no consensus in terms of how to characterize this syndrome. What we do know is that the long-term effects of COVID can involve every other organ system. So when we talk about the lungs, we know that after the initial insult, there can be permanent scarring or fibrosis that we see, and patients may need to be continued on oxygen therapy. What I have seen is that a majority of these patients do recover, but the recovery time process is very slow. Long-term COVID-19 can also manifest with signs of heart failure. We know that there's inflammation and injury to the heart, and that can also exacerbate existing cardiovascular disease. So when the initial symptoms of COVID-19 were described, one of the symptoms was the loss of smell and altered sense of taste. So this is very suggestive that the virus not only affects the lungs, but it can also affect the nervous system. So common symptoms that patients may have in the post-COVID syndrome is headaches, persistent headaches, dizziness, and fatigue. And we also have to look at the other psychological effects of COVID-19, and patients are presenting with depression, anxiety among the post-COVID syndrome. So we also know that the COVID-19 infection can also affect the vascular system, and patients can form blood clots. And depending upon where these blood clots, you can have pulmonary embolisms or strokes, and that can also have long-term effects. So here at Newark Beth Israel, we take a comprehensive approach when we evaluate these patients who have post-COVID syndrome. And as I just explained, the syndrome can really affect other organs, and the management can get really complex. So here, our patients have access to a wide variety of clinical expertise. So for example, as Dr. Migliore just mentioned, we have the largest PH team in New Jersey who can help if patients develop symptoms of pulmonary hypertension. We have our cardiologists, including our advanced heart failure and transplant team, who have extensive experience and are available to see patients who develop heart disease from COVID-19. Our cardiothoracic team are available to provide mechanical support devices if patients need them. So this is a prime example on how we take a multidisciplinary collaborative approach on treating a complex disease such as post-COVID-19 syndrome.
Thank you, Dr. Lee. And then next we have Dr. Gomez.
Hi, good evening. happy to participate and also explain a couple of the other issues that we can offer here at Northwest Israel and in the health system itself. Because it's not infrequent that we get calls in a question basis or referral basis, and because of our comprehensive team, as Dr. Lee just mentioned, we can guide the therapy or we can guide how to refer these patients to us. So what clinical interventions can we do for these patients? So Dr. Lee already mentioned those patients with post-COVID syndrome that have passed the acute phase. Some of them can be treated with medicine. Some of them can be optimized with heart failure medicines, and depending upon what other organ has been affected. Like, for example, with Dr. Migliore, they develop pulmonary embolism, then they will be anticoagulated, and Dr. Migliore will follow those patients. Now, there is another set of patients, are those patients in the acute phase, not the post-COVID, but during the COVID, in the acute phase. So we have the possibility of offer to those patients, as Dr. Lee mentioned, mechanical circulatory support. And more specifically, either those patients will need mechanical ventilatory support and where they will be intubated, or some others will need what is called ECMO, or extracorporeal membrane oxygenation. Those patients usually are in more acute phase, and some of them, because the irreversible injury that the COVID pneumonia or the COVID ARDS produced to their lungs, those patients will have no other option other than probably lung transplantation. But in order to get to that phase, in the post-COVID state, they need to be COVID-free. They cannot have viral in their body, and they need to be a proper candidate for transplantation. So the question is, who is candidate for lung transplant post-COVID? Majority of time has to be somebody with a single organ failure, just the lung organ failure, in which they have already passed the acute phase and the acute irreversible injury is not allowing either to win from the ECMO or from the mechanical ventilatory support. Is that pathway that will allow Dr. Lee and our group to evaluate those patients in a multidisciplinary way to see if those patients are proper candidates for transplantation. And because the deepness of our team, we already have done that. So we have done 2 patients with post-COVID transplant, and both of them survived. It has been well reported that the best outcomes for post-COVID patient transplants are those who can ambulate, are those who are nutritionally optimal, who are conditioned, some patients with no infections, no cancers, and no other organ failure other than the lung irreversible injury. Those patients who will be candidates for transplant, how do they do during the journey? So they can be at the hospital with the ECMO or the mechanical ventilatory support until they become candidates and that can be listed in the transplant list. Obviously, they're going to be follow a daily rigorous evaluation and assessment and optimization. So that means that our social services will help the families to integrate in the care and the planning post-transplant. They need to be seen properly by the nutritionist, by the pharmacy department. They're going to be seen by the physical therapists in multiple ways. Even with ECMO, we have a strong and very integrated team that can ambulate patients with the ECMO. We have mentioned the word ECMO. ECMO is basically a mechanical circulatory support for respiratory failure. So those are those patients that we put cannulas in the neck or cannulas in the groin, and the blood comes out through these cannulas and goes to a cardiopulmonary system that is a portable system next to them, and the blood gets oxygenated and returned through the same cannula. So that way we do sort of like an artificial lung therapy so they can breathe to the transplant. And we can perform those, and actually currently we have a couple patients on ECMO waiting on the transplant list. Patients with COVID, because this is a regular question, patients with positive COVID are not candidates for transplant. If you still have a virus in your body, we cannot transplant. We can only do that after you have cleared the virus and you are in the post-COVID phase. I will say that unfortunately it happens not in our program, but the Journal of American Transplantation reported a case in Michigan in which a patient did receive a lung transplant who was initially negative of a donor who was negative at the hospital, and it was no symptoms. And those organs were retrieved and they were transplanted in a recipient who did not have COVID. And unfortunately, this is the first case reported by organ transmission, by organ transplant transmission in the world. So that happened only one time in 40,000 transplants that were performed in 2020. And unfortunately, that patient that received this organ passed. So that led us to the conclusion that we cannot afford to do a transplant somebody in the acute phase. So that's very, very important to understand. And we have plenty of resources, team that can work through these patients during the acute phase and being positive to make sure that they are negative, that they get the proper therapy, and if the lung injury is irreversible, we will be able to transit them to see if they are candidates and be able to perform successfully the transplant. It's very important that we follow the guidelines for the CDC and the International Society of Heart and Lung Transplant, in which every single transplant that we perform nowadays does require a recipient with 2 negative COVIDs and a donor with negative COVID as well. So for those other patients who, as Dr. Migliore referred to, for the lung clinic and diseases that we see, they can rest assured that the transplants that we do today for these patients with no COVID, with COPD or sarcoidosis or pulmonary hypertension, they will get organs that are clean and their transplant will be successful. Because we learned a lot from last year's experience, we're still open, we're still doing transplants, and we have very successful results. So we're just going to leave it as that for now.
Thank you, Dr. Gomez. A question for the panel is, what are some of the signs that we may be experiencing with post-COVID syndrome?
Sure. So really the signs can be very, very variable. We see post-COVID syndrome people who obviously had COVID in the past and they have recovered from the acute illness, but they still have some lingering symptoms, or they may have new symptoms. So commonly what we see is patients who say, even though my breathing has improved since the initial infection, I still feel short of breath. And the shortness of breath is maybe when I walk up the stairs. Or we have patients who come in and say, even though I feel much better, I'm just fatigued and tired all day. Some people have headaches, and others may complain of just kind of low-grade fevers. So, the symptoms that you've had during the acute infection may linger on, and it may be more subtle, not as intense when you were sick, or they may be new symptoms that you may be experiencing after the initial COVID infection. So because the symptoms are so variable between people to people, it's very hard to kind of come up with a comprehensive list of symptoms, but these are things that you should be aware of and talk to your doctors about, especially if you've had COVID in the past and you're experiencing some of these symptoms.
Do you think, Dr. Migliore, that if we are experiencing some of these symptoms of post-COVID, that going to the post-COVID recovery clinic or finding a specialist would be useful or helpful?
Yes, so part of our post-recovery clinic is we address all of these symptoms that Dr. Lee has just previously mentioned. So we do a full evaluation of patients addressing symptoms such as their shortness of breath. We may do a full pulmonary function test to see how their lung function is doing, along with having them just simply walk back and forth and see how their oxygenation is, and doing an echocardiogram, which is an ultrasound of the heart. So it's important that we go and look and address all these signs and symptoms, because there's still so much about COVID and the post-COVID syndrome that we really don't know a lot about. So it's important to, to follow up either with our post-recovery clinic or their physician.
So there's a question, another question out there is that, how does a patient know, right, whether they should be seeing their general practitioner or, maybe the specialist? When is that time that we switch over care or ask, is it needed?
Yeah, that's a good question. I think from my experience in terms of seeing patients who had post-COVID syndrome, more often than not, patients come and see a specialist when they feel like their issues are not being addressed, they're not feeling heard. And I think sometimes for general practitioners who may not be as familiar with the post-COVID syndrome, a lot of the times, a lot of the tests that they do may be normal, and we don't know what to attribute it to. So I think that if patients are having symptoms and have had COVID in the past, even if they're being adequately treated by their general practitioner, they should come to the clinic to get seen, because there are other things that we can do in terms of other testing that may be possible, that we can do, like Dr. Migliore had mentioned.
So if someone was to want to try and make an appointment, how can someone go about that, trying to get an appointment with us?
So we have a direct contact number at our hospital, which we'll put up on the screen a little bit later. I can give you the number. I have it right here. It's 973-926-4189. They can also go online at rwjbh.org/lung transplant. This can put you direct contact with one of our coordinators here that basically would do a screening and do a telehealth visit addressing all your signs and symptoms and send up an evaluation, so that when you come into our clinic, you're coming in with already testing done, and we don't have to necessarily sit and talk and then send you out. So we try to do this, in the most efficient, multidisciplinary way possible. And our physicians who are seeing all our post-recovery patients these are the physicians who were on the front line all of last year working at Newark Beth Israel and with our community. So we are here to try to help them and there was a lot of patients out there who did not get admitted because they just weren't sick enough, and a lot of our hospitals were at capacity. So these are the patients that still have lingering effects. So we want to address them, and we're trying to make it as streamlined as possible for them.
Like several times we've touched upon multidisciplinary approach. Dr. Lee, you talked about different organs and specialists that would be involved in the care. But are there other services, like for instance, physical therapy or nutrition, that would be important in patients with post-COVID?
Yeah, no, absolutely. And I think that, the post-COVID syndrome, because it affects the entire body, I think that's the approach that we have to take when we manage and take care of these patients who have post-COVID syndrome. So it's not just about seeing a pulmonologist or a cardiologist. It's more about having a whole team together who can take care of your body and the symptoms that you're experiencing. And besides the clinicians, other important aspects would include, as you had mentioned, physical therapy and pulmonary rehab. We know that patients who've had chronic lung diseases or who have lingering effects of COVID in their lungs do get deconditioned either from a prolonged hospital stay or for being sick for such a long time. And these patients from the deconditioning do benefit from some sort of pulmonary rehab or physical therapy. We also know that post-COVID syndrome puts the body in what we call a catabolic state. That means that the body is constantly breaking down muscle and proteins. So we know that nutrition is also an important aspect in terms of the recovery process. So that's one of the benefits, in terms of our post-COVID clinic, our COVID recovery clinic here, is that it's not just you get to see one physician, but you're seeing a whole team members who have their own expertise in different areas. And the collaborative approach is really, it should be the standard of care in terms of how we manage these complex situations.
And just to add on what Dr. Lee was saying, the multidisciplinary approach, what's great about the Newark Beth Israel Recovery Clinic is that it's all located centrally within, our area, where we're sharing the same area with our advanced heart transplant team and advanced, therapies for heart transplant. We're with the lung transplant team. Physical therapy and nutrition is all a part of our office in one location.
I just want to also, Dr. Lindner, add to that, and this is more specifically for those patients already in the chronic phase of transplant. We work with and collaborate with other institutions along or outside our health system. And I can bring an example that we have now one patient on ECMO who we have very closely followed, and even our head of pulmonary service has gone and visit and evaluate the recovery and the optimization of these patients. So I think communication and collaboration with other institutions are very key also. And we have evaluated patients in the outside of our MBI, and those patients are being planned to be listed for transplant. So I just want to mention that obviously it's very important to communicate to our center, as Dr. Migliore said, but we can do collaborative care for those patients that they are candidates for lung transplantation and be successfully candidates and put on the list for organ transplant afterwards.
Thank you. Linda, do we have any other questions?
We do. We have a couple of good questions here. How prevalent is post-COVID syndrome?
Yeah, that's a good question. I think that to be honest, we don't know the exact numbers because it's still an ongoing process. If you look at some of the literature, some studies quote as high as 50% of their patients will have some kind of lingering effect, and other studies will quote as low as 20 to 30%. So you can imagine it's somewhere in between, in the middle, in terms of how prevalent it is.
And does it affect only patients with severe COVID, or does it affect you if you even had mild version?
No. It affects patients who've had either mild symptoms, moderate symptoms, severe symptoms. It doesn't really distinguish between the severity of the initial COVID infection.
I think I want to add to Dr. Lee that is a very key point, because and Dr. Migliore can tell us a little bit more, but it is not uncommon that patients with mild symptoms might develop progressive lung injury and progressive and recurrence of weakness and fatigue that then will lead them to lung failure. So maybe Dr. Migliore can talk to that maybe a mild case can progress to the future to a more complicated case.
Yes, so we know there's a lot we don't know about COVID, and I think that's why it is important to continue to follow up. We've seen patients in clinic who have had mild COVID symptoms, and they've just kept progressing and feel more and more short of breath. as time has gone on. Despite being COVID negative and COVID has resolved itself, the lingering effects is just something we don't know. So I think, you know, the other benefit of coming to the clinic is to keep you monitored with this and keep you following over the next course going forward. The other thing is that all the patients we've seen, they have the same common complaints that Dr. Lee had touched on earlier. And when they come in and I say, you know, you're not alone, every single patient that we've seen has described something similar to what you're feeling. It actually puts them a little bit more at ease to know that it's not in their head. They don't feel like they're the only ones out there. And that's another important aspect of treating it and going forward, again, to monitor things like their CAT scans and their pulmonary function testing and how they're doing with walking and things like that.
I think that's it for the chat.
Okay. So any final thoughts about what people should do if they're experiencing these symptoms and are in need of some pulmonary care?
Well, first they can always, you know, check with their provider, their primary care physician. They're the gatekeepers, and then they can always discuss it with them. We work in contact with a lot of primary care physicians in the community. So they can reach out to us, the patient can reach out to us, and we'll put the information up again for everybody. We're trying to make it as streamlined as possible, and just know that this post-recovery syndrome is, you're not alone, and there are so many people that are experiencing this. And we would love to see you and treat you and take care of you with our team.
All right. So I'd like to thank our panelists for all their great work and the information that they have provided with us tonight. For more information on the program or to learn how to refer a patient, you can call us at 973-926-4189 and also make an appointment at rwjbh.org/lung transplant. Thank you for attending this evening and have a wonderful night.
Thank you.
Thank you.